already first COPD, chronic bronchitis completed. This one is the second type of COPD, chronic obstructive pulmonary disease, emphysema. What is emphysema? It is a disease of sinus. So this one, it is a disease of sinus. Chronic bronchitis means trachea to bronchi. This one, anus part having disease. So it is a disease of sinus. And emphysema is a disease of sinus. See the level of different. But the risk factor is common for both of them. That is smoking. Smoking can lead to chronic bronchitis and emphysema also. But pathogenesis is different. The level of obstruction is different. So that is the definition of emphysema. It is a last terminal bronchioles permanently dilated. So last terminal bronchioles, that one is permanently dilated. They fuse with each other. They fuse with each other. Here fusion. Fuse with each other. The multiple alveolar sacs fuses with each other. Why? Because of wall get weakened. This reason. Why their wall get weakened? Due to smoking. Due to smoking. So the wall get weakened. So they fuses with each other. So they fuses with each other. Because of their fusion, big space is formed, which are known as pullae. So which are known as pullae. Because of their formation of pullae, the obstruction will happen. So how define emphysema? It can be permanent dilatation of air space. Which air space? It is not dilatation of the trachea and bronchi. Here dilatation of air space, air shock. Dilatation of sinus, that is all the air structure which is distant to terminal bronchi. How you the complete sequence. First leads to nose leads to pharynx leads to larynx, up to this upper respiratory tract. It leads to trachea leads to bronchi. This one leads to bronchioles, primary, secondary, tertiary and terminal. After that we have sinus, respiratory bronchioles, alveolar duct, alveolar shock. These three parts fused each other. So emphysema, the ball get weakened and multiple structure fuse with each other. So the name, the structure sinus fuse with each other. So it is the disease. So all the things which are distal to terminal bronchioles. You can see the terminal bronchioles. This disease is known as emphysema. The terminal of bronchioles will affect distant to terminal bronchioles. This is known as emphysema. Now, etiology. What is the reason for destruction? The wall of acids having two type of enzyme. First one name is called as protease. Second one name is called as antiprotease. So, protease, the name indicate it degrade protein. Antiprotease, the name indicate inhibit degradation of proteins. Both are equal and opposite. Both are equal and opposite. They balance each of others in a normal healthy individual, but sometimes due to smoking, some people smoke due to smoking. What is happening? Protease increases, antiprotease decreases. So protease level increase, antiprotease level decrease because of smoking. Protease increases, antiprotease decreases because of smoking. This is imbalance. Due to imbalance, there is more degradation, less inhibition that leads to fusion of multiple wall, of destruction of wall, that leads to big space formation, building. This is known as protease antiprotease theory or protease antiprotease hypothesis. What is protease? Now the other name of protease and antiprotease. Protease have other name elastase. It also known as alpha-1 trypsin. Antiprotease have another name anti-elastase, also known as alpha-1 antitrypsin. Normally, protease is equal to antiprotease. So, we can say elastase is equal to anti-elastase, or alpha-1 trypsin is equal to alpha-1 antitrypsin. So, this alpha-1 antitrypsin, these are the enzymes which inhibit degradation of protein in the wall, but normally there is a balance between normal person who do not smoke, but there are some person smoke, and the smoking do what? Smoking increases all these enzymes. So smoking increases all these enzymes. So imbalance happen. Protease and antiprotease presented in all the wall. So all the walls protease and antiprotease is presented. The person smoking, protease increases, antiprotease decreases. So the fuse with each other. Because of wall become bleach. So wall become bleach. So they fuse with each other. The respiratory bronchioles fuse with each other. These alveolar duct fuse with each other. These alveolar shock fuse with each other. Correspondingly, they just fuse mass. So mass with each other. So ultimately big space are formed, which is known as bulle. So that one name is called as bulle, the mass. That is the disease is known as emphysema. So mass, all are fused with each other, so they form a mass. That name is called as bulle. So that disease name is called as emphysema. Classification of emphysema. It is very important disease having 5 different type of classification. Centri-acinar or centrilobular emphysema, panacinar emphysema, panasinar or panlobular emphysema, paraseptal or distal acinar emphysema, irregular or cicatricial emphysema, and mixed or unclassified emphysema. Here fusion will happen anything. So 5 different type of emphysema: centriacinar, panacinar, paraseptal, irregular, and mixed form of emphysema. So see the overall diagram of acinus. Only respiratory bronchioles is dilating and other things are not dilating. Only respiratory bronchioles are dilating. So respiratory bronchioles in the center, in the central structure, and everything arising from it. So such emphysema which only in respiratory bronchiole dilating, others are not dilating. Such emphysema is known as centriacinar emphysema. Only respiratory bronchioles is fused, so it is called as centriacinar emphysema or centrilobular emphysema. Multiple alveolar sacs are fused. Alveolar sacs fused together. That name is called as distal or paraseptal emphysema. Then alveolar ducts and alveolar sacs both are fused. This one name is called as panlobular. Alveolar duct and alveolar sac fused. That one name is called as panlobular emphysema. So only respiratory bronchiole affected means centriacinar emphysema. Only acinus ducts, acinus sacs affected name is called as distal or paraseptal emphysema. Alveolar duct and alveolar sacs affected, that name is called as panlobular emphysema. Completely fused, everything is fused, that name is called as parascicatricial emphysema. Among 5 different type of emphysema, the centriacinar most common type, it is occur in upper lobe, predominantly in heavy smokers. Grossly, the lungs are voluminous, pale with little blood. The edges of the lungs are rounded. So dilated cavity of pullae. Here bulb formation due to fusion of multiple acinus bullae and plug are formed. Bullae and plug are formed. Diagram is there. Then coming to bullae, air-filled cyst-like structure. Plugs are rupture the alveoli directly into the subpleural interstitial tissue. Microscopically, all the portion of acini are distented. Respiratory bronchioles, alveolar duct and alveolar sacs. So multiple alveolar sacs is there. This one is the alveolar sacs. They are fused with each other, so fusion is there. You can see that broken septa. This one is the broken septa. Microscopically, they are distended, dilated, the wall stretched, and thin broken septa are seen. Coming to clinical features, chronic bronchitis, cough followed by dyspnea. Here, dyspnea is followed by cough. Main clinical feature, dyspnea. Breathing difficulty followed by patient also having cough occur later. So, dyspnea followed by cough. Here, patient is well oxygenated. So, that is known as pink buffers. Weight loss is common. Radiography, heart enlargement of both of them. Heart enlargement. So, this is all about emphysema.